Complications with contemporary vein treatment are really minimal. Most of what we do is done with a needle, with an injectable solution, or with a nick in the skin through which we can advance a catheter into the vein, or whether we physically remove that abnormal vein. And so everything is done at the most with a 1 to 3 millimeter incision. So the risk of infection is low. There's always a risk of bleeding anytime we put a needle across the skin, but by and large, everything that we're doing is in between the skin and the muscle where there are no large arteries, so the risk of bleeding, therefore, is quite minimal. Other complications, such as blood clots in the veins, happen very uncommonly. In the past, with vein stripping got a really bad reputation because in a lot of situations, it was done without a thorough diagnostic ultrasound ahead of time. And so the surgeon was going in basically blind and saying, well, I think that's abnormal, let's treat it. And the treatment was very morbid. A lot of people would have problems afterwards in terms of lots of bruising, lots of tenderness. Sometimes they would have nerve problems as a result of injury to nerves that were inadvertently treated during the procedure. And so it got a really bad reputation of causing problems from the treatment and incompletely treating the vein problems. And so we don't typically see that anymore. Ablation is very safe. Phlebectomy is very safe, injectables are very safe, and in the right setting with a good diagnostic evaluation beforehand, you can expect well less than 1% risk of complications with this treatment.